That's right. Well, if you've recently become pregnant and you're wondering how to keep yourself and your baby healthy to full term, Dr. Roz is here to help us debunk some of the myths surrounding pregnancy with what's safe and what isn't. Welcome back.
Great. It's good to be here.
Yeah, this is a great topic for anybody that's maybe considering becoming pregnant or is pregnant and maybe, you know, either hasn't asked the questions or maybe has is thinking about asking their doctor some of these, because there really are. You know, we obviously know the main do's and don'ts, no drinking, no smoking, things like that. But there's some other ones too.
Yeah.
Tell me about your first one, which is exercise. Can we exercise during pregnancy? Should we?
Absolutely, you can, and you should.
Okay.
I think it takes a combination of things to have the best experience on labor and delivery. One of those is good pain control. Obviously, you can do that on your own or with an epidural. It always helps. Sure. But, you know, being flexible and having good tone. And you may think like flexibility and doing tone when you're pregnant. Yeah, you can do that. And exercise actually helps. Helps you sleep. Helps with a combination of things. And
then if you are concerned about a specific type, you might want to ask your doctor about that specific type.
Yeah, absolutely. You know, you absolutely want to avoid contact sports or anything like that. Basketball, soccer, not a good idea. But you can swim. That's great exercise. Okay. Anything to tone your muscles. So there's a combination of things that you can do. There are certain times in a woman's pregnancy that she may not be able to do any of those, any exercise, actually, if she's
high risk or something.
If high risk or threatening preterm labor, absolutely.
So many pregnant women, they see food and they eat it. Let's talk about seafood, though.
Right. Seafood and eat it, exactly. But seafood in particular, can you eat seafood? Yeah. Certain ones you can, certain you probably do not. It's recommended that any of the seafoods or fish that's high in mercury, that you avoid those. Okay. Some of those would be like shark, albacore, tuna,
mackerel,
mackerel. Okay. Yeah, so avoid those.
We're talking about travel a little bit. We want to exercise. We want to do those things. What about traveling? Can we travel pregnant?
You absolutely can travel when you're pregnant. However, I would encourage, and it is recommended, that if it's close to delivery, you may not want to do that, whether it be by plane. But one of the things that's very, very important when you're traveling is a safety belt. Always be safe, so for you and for baby. Okay. So you never put that safety belt, that strap across your belly, across the baby. You put it underneath. Yeah, or it can go over, you know. Okay. As well. So because if there's an accident and if you jarred and you could shear the placenta away, so it's very important to protect yourself and the baby. Okay. Yeah, but traveling is, you can do that.
Okay. Let's talk about sex.
Yeah.
Want to?
Yeah. Let's do that. Everybody wants to know about that, particularly dads. And you can have intercourse when you are pregnant. A lot of times a couple may feel that they could hurt the baby, and you absolutely cannot. Are there certain situations where you should not have intercourse? And there are. Okay. And so your OB-GYN will definitely let you know when those situations are upon you, whether it's preterm labor or there's something called a placenta previa. There are times when it's not recommended. Not so good. But the ideal time is closer to your due date. You know, baby's not coming, and what can I do to get things stimulated? Yeah. Having intercourse can help, because that uterus contracting. Okay.
Before we go, 2 more. Hair coloring and flu shots.
2 common questions. Yes, you can color your hair. Okay. And flu shots are absolutely recommended any time in your pregnancy. Okay. Yes. We want to have that. Thank you so much for being here. Of course, if we have any more questions about pregnancy or anything else, we can always visit you at drrozmd.com. Absolutely. It's great.
Thanks so much.